According to the International Diabetes Federation, 8.8% of the population has diabetes mellitus. Mostly they are type 2 diabetic patients, while type 1 diabetic patients only comprises 10 to 15% of these numbers. They both are radically different diseases but have something in common: make patients' life more difficult. Now let's focus on type 1 diabetic patients. Type 1 diabetes flowering is justified, it seems to be, for an autoimmunological attack from T lymphocytes to the so-called beta pancreatic cells in the Langerhans islets. Those are a group of cells located in the pancreas, an abdominal organ that produces the hormone insulin. Insulin is an essential hormone. Yes, we cannot live without insulin. That necessarily means that type 1 diabetic patients which have a partial or total insulin insufficiency have to use exogenous insulin to survive. Yes, auto-inject insulin every single day. Two ways to do that: insulin pens, which contain fast-acting insulin or long-acting insulin analogs. Some pens contain a mixture of both fast and slow-acting insulin and are called intermediate insulin, or continuous subcutaneous insulin infusion, or insulin pumps. A diabetic patient has to face diverse barriers throughout life. Plenty of glucose controls, which means plenty of punctures in your fingers. Be continually alert and worried about glycemia levels. Frequent and lifelong medical follow-ups. Increased cardiovascular and complication risk. But there is something which conditions diabetic patients' life and we do not usually consider. It's exercise. Yes, exercise is highly beneficial, and this is not prime news. It diminishes the risk of all-cause death, having a stroke or heart attack, colon, breast or prostate cancer, having dementia, depression or osteoarthritis, and on top of that, it improves the quality of life. But when you are a type 1 diabetic patient, doing some exercise is not easy at all. And patients know. In a non-diabetic person, when we start to exercise, a neuroendocrine response to this physiologic stressor happens. Insulin levels drop immediately because we need not insulin at this moment. Remember, insulin is an anabolic hormone that facilitates energy storage, introducing glucose and other nutrients inside cells. During exercise, our objective is just the opposite: make good use of stored energy in the form of glucose, glycogen, and fat to face the energy demand exercise produces. Parallel to insulin decline, other hormones levels start to rise. We are talking about the so-called counter-regulatory hormones: adrenaline, noradrenaline, cortisol, growth hormone, or glucagon. Those hormones' mission is to create a fight-or-flight response, so they are hyperglycemia-creating hormones. They raise glucose levels. Additionally, the liver acts in this context and in response to these counter-regulatory hormones, producing more glucose in a process called gluconeogenesis. But what exactly happens in the type 1 diabetic patient? As we said before, the main problem a type 1 diabetic patient undertakes is insulin insufficiency. For that reason, insulin levels in our patients depend on external administration. In a non-diabetic person, insulin is tightly and precisely regulated to face daily demands, exercise, food intake, or maybe sleep. But in a type 1 diabetic person, regulation is up to you and your decisions. So, the exercise in diabetic patients have to necessarily play with two crucial factors to avoid hypoglycemia. Yes, the fall in glycemic levels, which can be fatal. Those two factors are 1. Insulin, and 2. Carbohydrate intake. From the correct balance between those two factors, we will have a high or low risk of hypoglycemia and other diabetes-related problems. While exercising, muscles consume glucose, so glucose levels tend to diminish. when we have not adjusted fasting or slow-acting insulin beforehand, we can have some problems. Additionally, the liver of a diabetic patient senses higher than normal insulin levels while exercising if we hadn't made any changes and stopped to produce glucose. So, gluconeogenesis does not happen or is dampened. So, what is the next step? Which recommendations do we have to follow? If we reach 150 likes, we will have an in-detail talk about this and much more in the next video. Don't forget to subscribe, stay healthy and strong.